हेलो एंड वेलकम टू ग्रेडअप। ग्रेडअप में आप सबका फिर एक बार स्वागत है। और एंड वी आर हियर अगेन विथ आवर वन मोर सेशन ऑन करंट अफेयर्स। सो दिस इज अ स्पेशल सीरीज फॉर UPSC CSE Prelims 2021. So this is our series on current affairs for UPSC CSE exam, right? Good afternoon, Nandini. Welcome to Gradeup. Share this session so that as many people as can join. Good evening, sweetie. So this is our special series for current affairs issues for UPSC CSE 2021 exam. Sapna, good afternoon. Good afternoon, Nikhil. It should be okay now, I guess. Is it fine now? Okay, it's good. So we'll start. So do like and share this session with your friends. So let's take the very first issue for today. The very first issue is National Digital Health Mission. So Prime Minister has launched the National Digital Health Mission. So we'll understand what this National Digital Health Mission. We'll also understand what we are aiming through this National Digital Health Mission and what other issues are there with this kind of schemes and missions. So let's see what this National Digital Health Mission is. So the vision of National Digital Health Mission is to create a national digital health ecosystem, right? So what we are aiming at creating a national digital health ecosystem, right? So which it will provide timely and efficient access to inclusive, affordable and safe healthcare to all citizens. So we have to understand that when we are talking about National Digital Health Mission, so we are aiming at providing an inclusive, affordable and safe healthcare. So we will make use of digital technologies, whatever technologies are available with us, and with that technology we'll ensure that we are giving our citizens an inclusive, affordable and safe healthcare. So let's see what is this National Health ID system is under the National Digital Health Mission. So we are going to create a National Health ID. So it will be a repository of all health related information of a person. So if you are an individual, you will be given a health ID. So this is your health ID. So it will be a database, right? You will have your own ID with that database, and in that database we'll have all your details regarding health, right? So whatever health issues you are facing, whatever your nutritional and health requirements are there, all will be mentioned in this particular ID. So according to the National Health Authority, every patient who wishes to have their health records available digitally must start creating a health ID. So if you want your health records to be available in a digital format, so you have to create this health ID. No, Sahil, it is a scheme for all our citizens, right? So it is not just for poor. So when we are saying health ID, a digital scheme, so it will be available for all of the citizen, and we are going to create a record of our health issues and requirements. So this record will be available digitally, right? So once these records are available in a digital format, you can access them everywhere, right? So each health ID will be linked to a health data consent manager such as National Digital Health Mission, which will be used to seek patients' consent and allow for seamless flow of health information from the personal health record module. So whatever your data is there would be some database regarding your health, right? You'll be asked to give a consent. so that going to flow seamlessly through the information system, right? So there is one most important part you have to understand, that your consent is necessary in this case. So again, it is buffering. Can everyone confirm if it is buffering? Okay, I guess it is now going good. Let's move further. So the health ID is created by using a person's basic details and mobile number or Aadhaar number, and this will make it a unique to person who will have option to link their all health records. So we'll see what else we are going to do. So this health ID, it was originally proposed in National Health Policy of 2017. So it had envisaged creation of a digital health technology ecosystem aiming at developing an integrated health information system that serves the needs of all stakeholders and improves efficiency, transparency, and citizens' experience with linkages across public and private healthcare. So we have to understand what we are aiming at. So what we are aiming at, a digital health ecosystem, and with this digital health ecosystem, we would be knowing all the health related information of our citizens, right? So whatever information is there, it will be available in a digital format. It will also be shared across the spaces, so public sectors and private healthcare providers all will be getting this particular data. So in this database, with the help of this database, we can have better planning, better management of our healthcare system, right? So that is what is being aimed with the help of this health ID and digital health technology ecosystem. Also, you can take example of any individual. If an individual is having certain health conditions, so whenever it is required, and if this data is available in digital format, so you can access it anywhere. Any public and private healthcare provider, whosoever is providing healthcare services to that individual, would be knowing what kind of health situations a particular individual has, and that is what the advantage of this particular health ID and this digital health ecosystem, right? So in this context, central government's think tank, that is Niti Aayog, in June 2018 floated a consultation of a digital backbone for India's health system, and it was called as National Health Stack, right? Now let's see what other benefits are there with this national digital technology wala health ecosystem, right? So it will help greatly to reduce the risk of preventable medical errors. So we all know what kind of errors can be done whenever we are providing any medical care, right? So this particular risk can be prevented, as you will be having a lot of data to understand the conditions of a person in terms of health, and significantly it will also increase the quality of care, right? Okay, Neeraj, there is YouTube. You can access this particular series on YouTube also. There are lectures which are available on YouTube regarding this current affairs series. And also, if you go to Gradeup app, even in Gradeup app, you can find this particular series, right? So there is absolutely no issue that you will not be getting these all lectures. So follow this series so that you are able to cover all the current affairs issues. Okay, the system enabling users to obtain a longitudinal view of their health records. So this is also a benefit of having technology in our health system, and it will also help in preparing a strategy overview document. So last month, for making India a digital health nation, enabling digital healthcare for all. So once we have this kind of thing, we can also have a better strategies as well. Now, which systems does the national health ID interact with? We have to see what, once you are getting this national health ID, so where all it can be used, it can be accessed. We have to see where it can be used and access and interact with. So as envisaged, various healthcare providers such as hospitals, laboratories, insurance companies, online pharmacies, telemedicine firms, they are expected to participate in this health ID system, right? So largely you might be asked a question regarding this health ID, that this particular information will not be available to anybody else but the individual and his any healthcare provider. So if that kind of statement is made, that statement would not be correct. So if you want to see whosoever is going to have access to national health ID, so a lot of healthcare providers will be having an access to this health ID system, so that they are able to understand what kind of health issues people are facing with, what kind of population is facing health issues, in which region certain health issues are there. So all this information will be compiled in one, and then there we can have a better strategy to tackle with the problems related to our healthcare system. Right now, there is one more piece of information when we are moving forward to this national health ID or this digital technology enabled healthcare ecosystem. So we have to take experience of past as well. So in past there was such an attempt made by United Kingdom. So what United Kingdom did, they tried to create a global centralized health record system. So it was started in 2005 by National Health Service of United Kingdom, and it was like a electronic health record system with a goal to have all patients with a centralized electronic record by 2010. So that was what being aimed by United Kingdom's National Health Service. But what happened eventually, while several hospitals acquired electronic patient record systems as part of this process, there was no national healthcare information system. So they did create certain kind of information, in certain records were created, but there was no national information exchange system where all these records could be shared. And once you shared all these kind of records at a national level, the use of these records could be done in a very efficient manner and in a very meaningful manner, right? So since this particular information exchange was absent, so not much could be obtained out of this particular initiative by United Kingdom, and ultimately this program was dismantled. So we have to learn that whenever we are going to create this kind of system at such a huge level with such huge amount of data regarding our citizens' health, we have to ensure that the end use of it is appropriate, and also the system which we are going to put in place should be robust and should be fail proof, right? So that we are not again failing in creating any such systems. So there is also this particular estimate that around 12 billion pounds were lost in this particular initiative, most expensive healthcare IT failures it is called as, right? So that was about the national health ID. Now let us see one more important issue. This is a very important issue when it comes to current affairs. So there is a committee on minimum age of marriage of women, right? So you must be knowing that there is a minimum age of marriage. For men it is 21 and for women it is 18, right? And just to see if this particular division, if this particular differentiation between men and women is appropriate, we have now this committee so that we get to understand further this issue, right? So Prime Minister of India said that the central government has set up a committee to reconsider the minimum age of marriage for women. So it was done during his 74th address, the Independence Day address. So we will see what this committee is. So the committee is going to be headed by Jaya Jetli. So there is this lady who was a former president of Samta Party. So she is also, you might have seen her on television or in some other context as well. So she is going to head this particular committee. The committee also includes members of Health at Niti Aayog, Dr. Vinod Paul, and also several secretaries of Government of India. Right, so we have understood what kind of committee it is going to be. Then let us see what other issues are there. Committee or task force, it will examine matters pertaining to the age of motherhood, right? The imperatives of lowering maternal mortality ratio and the improvement of nutritional levels among women. So we have to see that this the task which is given to this particular committee is not only limited to see the age of marriage. It is not only about age of marriage, right? It will also look into the issues of those are pertaining to the age of motherhood, right? The imperatives of lowering maternal mortality ratio and the improvement of nutritional levels, right? Now see, we have to understand what this particular issue is. Now when we are saying that men have the age of marriage at 21 and women have it at say 18, so this is what the current laws in India are suggesting, right? Now there is absolutely no logical rationale to have such a differentiation. So the argument is, why can't both men and women have a same age? Let us say it should be 21 for both men and women, right? So this is one issue which is regarding equality. Now there is one more issue when we are saying that women's marriage age should be 18, so they are marrying at relatively lower ages. Now when this particular age is less, there can be certain health issues, right? So there may be that not maturity levels have not been attained, or there are certain health issues with women in this particular age, because bodies might not have been fully developed, right? So there is a traditional viewpoint of women attaining puberties and maturity at a lower age than men, and maybe because of that this particular differentiation have come. But in present day and age, we cannot certainly have such a biased opinion, and that is why all these things are being considered once again. And that is why we have to see whether when women are marrying at a lower age, is there going to be any health issues, right? Also, it has been seen in last so many years that if women are marrying at a lower age, it is ultimately going to affect their education. This is also one important issue, right? So if women marry at 18, obviously their education stops at 18 in most of the cases, rather in 99% of the cases their education would stop at marriage. If they are allowed to continue till 21, they certainly will have a better education, right? So there can be no doubt about it. Now there is one more issue, and it is regarding motherhood, right? So if we have seen, if women if they are getting motherhood at a lower ages, there are certain complexities which are there. So maybe in many cases when women delivers a baby, they cannot bear that particular situation, and we have a high mortality rate in that particular case, right? So our maternal mortality ratio is still high. We are trying to reduce it, but the higher maternal mortality rate is also an outcome of lower age of marriages, right? So this is also one aspect we are facing. So can anybody tell me what is the current maternal mortality rate in India, the latest figure? So this particular topic was recently in news also. In last few months it was in news, and we are also saying that the whatever target of maternal mortality rate, we are going to achieve that particular target before the given time. So what is the maternal mortality rate of India currently? Can anyone tell me on YouTube or Gradeup app? Right? Okay, so the current maternal mortality rate in India is at 113. Okay, so remember this particular point. There was recently an document was published regarding this particular fact. Now let us see, the task force will also examine the correlation of age of marriage, motherhood with health, medical well-being and nutritional status of the mother, and neonatal infant child during pregnancy. So all these issues which I told you earlier, so what kind of issues this lower age of marriage is generating, we also have discussed. The same has been mentioned regarding motherhood, nutritional status, right? So this committee, it will look into key parameters. So it will go through infant mortality rate, maternal mortality rate, total fertility rate, sex ratio at birth, and child sex ratio. So all these things. Also one more important point I would like to mention is regarding total fertility rate, right? If a woman has a lower marriage age of marriage is lower, let us say at 18, and let us say it has another, in a hypothetical situation it is 21. So the number of children, women who is marrying at a younger age, the number of children this woman would produce would be more. So this kind of total fertility rate increases in this particular case. So in many countries across the societies, it has been seen that whenever there is a lower age of marriage, the total fertility rate of any country, it increases, right? So it ultimately affects your population increases, right? And on contrary, as this age is at a higher level, the age of marriage is at a higher level, this TFR will reduce, and as TFR reduces, it helps in both. It helps in controlling population, and most importantly, it also helps in the health of women, right? It also helps in health of women. So this is the important part we also have to understand. Now this committee, it will also examine the possibility of increasing the age of marriage for women, right, from the present of 18 years to 21 years, right? So we anyway are considering to raise the age of marriage of women. Now why there is a minimum age of marriage? So there is a lot of history which has gone into this particular issue. We will see what this history is. We will just take a brief look out of it, because not a lot of question we are going to expect, because history is a little bit detailed here, right? Good afternoon, Tabassum. Hello. So we'll continue with this issue. So the law prescribes a minimum age of marriage to essentially outlaw child marriage and prevent the abuse of minors. So we need to understand whatever laws which are in place, they are essentially targeting the child marriages. If there is no law, obviously there is going to be a lot of prevalence of child marriages, right? So Tabassum, no issue if you are late. Whatever part you have missed, just go through the same part again, right? Good afternoon, Aati. Now see, personal laws of various religions that deal with marriage have their own standards, often reflecting their custom. So the common laws which we currently have, which are looking at preventing child marriages, they say that the age of women for marriage should be 18, and age of men should be 21. But then there are personal laws, let us say Muslim personal law. So what happens with in the case of Muslim personal law? Muslim personal law does not mention the age. It does not mention the age. It mentions the growth condition, that is puberty. It says that if the individual reaches puberty, then that individual can marry. And certainly it is assumed that an individual reaches puberty at the age of 15, right? And in this particular case, you can see the age of marriage of women gets reduced further, right? So that is one more issue. So it is also being said that with the help of uniform civil code, this all these things can be looked into. Now in case of Hindus, for Hindus, section 5(3) of the Hindu Marriage Act of 1955, it sets the minimum age, that is of 18 years for the bride and 21 years for the men, that is groom. However, child marriages are not legal, even though they can be declared void at request of the minor in the marriage case. So we have to understand that there is this particular act, the Hindu Marriage Act, and according to this act, the minimum age of marriage for women is 18, and for men it is 21. And also child marriages, they are illegals. But in case of Islam, as we have discussed, the marriage of a minor who has attained a puberty is considered valid. So this is a particular issue. So it is also being discussed. Now there is common law also. So Special Marriage Act of 1954 and the Prohibition of Child Marriage Act of 2006. So they also prescribe the same ages, that is 18 and 21, as the minimum age of consent for marriage of women and men, right? And additionally, sexual intercourse with a minor is a rape, that we all know, and the consent of a minor is regarded as invalid in this particular case, right? Because that particular minor is deemed to be incapable of giving consent at the age. So we also have to understand that as per the Special Marriage Act and also as per the Prohibition of Child Marriage Act, the age becomes again 18 and 21. Now we have to also see that how all these laws have evolved. So there is colonial history which goes into it, So we'll not be discussing a lot regarding this colonial part of the history. We'll just take a brief look out of it. We'll see briefly what all issues had been there and how it came. The Indian Penal Code, it was enacted in 1860, so it criminalized the sexual intercourse with a girl below age of 10. So the same thing, the age of consent, or whatever you call it. So similarly, it was criminalized in the Indian Penal Code of 1860. So earlier the age was 10, then it was again revised with the age of consent bill of 1927. So there was a lot of issues were there with the age of consent bill. This year in UPSC 2020 prelims paper, there was one question as well regarding the same issue. So we'll see what that question is in some other session. So for now, just understand that it is important. Marriage with a girl under 12 would be invalid, right? So it was with the introduction of age of consent bill in 1927. Now the law faced opposition, obviously, from the conservative leaders of the Indian national movement, who saw the British intervention as an attack on Hindu custom. So what essentially was being said by all these leaders, that let us decide our own issues, and let there be no intervention from the Britishers, right? So that was the conflict which was seen in this particular case. And a legal framework for the age of consent of marriage in India only began in 1880. So there are a lot of certain events which happened, which are also called as very radical events, which changed the course of society. There were certain organizations, there were certain individuals who had taken part in bringing out better situation for women in Indian history, right? So that is the part of history. We'll not certainly discuss a lot of history now. In 1929, the Child Marriage Restraint Act, it set 16 years and 18 years of minimum age for marriage of girls and boys. The law is also popularly known as Sarda Act, after its sponsor Haribilas Sarda. Okay, now he was a judge and a member of Arya Samaj, and it was again eventually amended in 1978, prescribed age again 18 and 21. So these all are very nitty-gritties in this particular issue. If you are able to remember, it's good. Otherwise also it is fine. No issues with that, right? Now let's see why is the law being relooked at. Again, as we said, gender neutrality is the issue. One thing we said, that why there should be any differentiation, why men and women should be treated in a different way. So that is the issue of equality, or say gender neutrality, right? To reduce the risk of early pregnancy is also one issue, and there are many other arguments in favor of increasing the minimum age of marriage of women. Now early pregnancy, again, as we discussed, it is related with the health of women, and it increases the child mortality rates, affects the health of the mother. Then there is also some court cases which can help this particular viewpoint. So last year there was this Delhi High Court. It also sought the central government's response in a plea which sought a uniform age of marriage for men and women. So this particular issue is under consideration by a lot of agencies as well. There is one judgment which we can say that it will help in this particular aspect. So there are two significant judgments. One is this particular judgment of 2014, that is from National Legal Services Authority of India versus Union of India. So it recognized transgender as a third genders, right? And it brought in equality. This was an issue of equality. So this particular case can help us in determining this issue. And also there is last year one more issue that was regarding Joseph Shine and versus Union of India, where Supreme Court decriminalized adultery, saying that a law that treats women differently based on gender stereotypes is in affront to women's dignity. Again, we have this one more one more judgment by Supreme Court which tells us to do away with the gender stereotype. And when we are saying the different age of marriage for men and women, it typically sounds as a gender stereotype again, right? So that was this whole issue. This is for today. We have covered two issues in a comprehensive way, right? So I hope you will revise this particular issue again. Let do revise this particular thing. Have your notes on current affairs as well. Whatever we mention as important in these sessions, write down it in your notes and ultimately revise this again, right? So this was all for today. We will again meet in next session on a UPSC CSE current affairs. So till then, stay tuned with the Gradeup. Have a nice day.